Why should pediatricians address health equity? It's such inequality between the haves and the have-nots, communities that are better off than other communities.
Medicine has been one of the perpetrators of racism and bias and disparities. So for many, many populations, people from all different backgrounds, who gets pain medicine, who doesn't, where are there hospitals and where there aren't?
Some people have to travel miles and miles and miles away, maybe without car fare or gas or transportation.
Especially in rural areas, because in rural areas, sometimes the disparities are the greatest. Even if you don't have a large majority of underrepresented folks there or folks of color, doesn't mean that those disparities don't exist and doesn't mean that those conversations shouldn't happen. So we have to acknowledge and address those racism factors within pediatrics and medicine overall to really make a meaningful difference in health in our society.
How do we truly give all people a chance to have the type of access they deserve?
I have been so privileged to be a part of this development of the tip sheets that we're trying to help providers and healthcare professionals to have conversations about racism and health equity within the pediatric setting.
This toolkit, it has frequently asked questions where we address questions that may come in the provider mind when talking about health equity, racism, and how does that impact children care. The second resource is about why conversational race matters. We know that adversities that happens in early childhood can affect child development till their adulthood and even across generation. So it's very important to address bias, discrimination, racism, and how it shows up in schools, how it shows up in neighborhood, and how it may affect the health and development of a child.
You cannot take care of the whole child without addressing all of the social factors that prevent that child from being healthy.
Every family is different. Every situation that presents itself will be different. It matters how you speak to them, and it matters how you relate to them. These tip sheets are really for pediatric health professionals to use to be the best advocates for the families that come before them.
Then the third resource, we have collated very important resources, evidence-based resources for the pediatric healthcare professionals. So they are at your fingertip. You can use them.
How I use them in my practice is trying to have a conversation and say, hey, have you heard about this resource, right? So to talk to my colleagues about it, but also to talk to patients and families.
I think what's best about when you use tips is make sure the tips are gonna fit with the situation that's in front of you. If you're gonna share something with me, share something that's tangible, and that helps me get something I need.
And then the fourth resource is designed for parents and families. This is a collection of resources that parents could use when having conversation about race. Some families, they are open to talk about whatever is going on, and then some families are hesitant. But at least they have an open, safe space to talk about it. And for me, I feel like if you make room for it, even if it does not happen today, they will know that they can come back to you and talk about those issues.
To be able to walk in and your pediatrician is asking those questions, it's like, oh wow, like you understand what's happening in the world. You may understand what's happening in my life.
Start building in some listening sessions. You want to be on the ground floor so that you can relate to people. That's how we save lives. It should be just a space so that you can be in your truth.
I would say for my colleagues, make your practice and every encounter a safe place for patients and families that they can entrust you with what's going on with their lives.
After reviewing the tip sheets, I think it's a start on how to create and respond to questions when it talks about the inequities that are felt by families every day.
The thought here is that this is a start. It's not a destination, it's a journey. And so as you're learning more and you're incorporating and you're reading and you're having more conversations, you may decide to use a different tip or use another resource, and that's absolutely the point. That allows you to be a better pediatric healthcare professional, a better person in the world, and that's worth it.